a little girl, I've always wanted to be a nurse. I had this desire to help people feel better, and I wanted to make a difference in the world.
When I started looking at nursing, I thought, okay, I'll look at it. It kind of fit the bill. I am the kind of person that likes to multitask. I like traveling. It just seemed to fit.
I wanted a career in which I could use caring for other people, caring for people, a career that involved working with people, and in particular for me it was really important to have something that I could work with children.
I started thinking about oncology nursing before I even finished nursing. I heard a very eloquent speaker from Children's Hospital. She was an oncology pediatric nurse. And that particular talk stayed with me, and I thought, you know, one day I'm going to do that.
I felt I had a calling to help people during their most difficult and vulnerable times. I can't change the fact that they have cancer, but what I can do is hopefully make that journey a little bit easier for them.
I think any nurse in oncology nursing in particular, any attributes that you must have are basic attributes that I think any nurse has to have, which is compassion, empathy, caring, patience, and a real love for people. I think in oncology nursing, and in particularly pediatric oncology nursing, you need to incorporate the whole family, and you need to be able to work well with families, with parents, aunts, uncles, foster parents, anyone that child would consider their support system or their family.
I would say the first thing that you need to do is sign up to CANO, which is the professional organization for oncology nursing. I would say that there's lots of support. There's conferences specifically for you that you can get bursaries for to go to these places for first and second year oncology nurses. She had metastatic cancer. We used to see her every week when she was first diagnosed. She said to the doctor that I was working with, you know, how long do I have? And he's, you know, eloquently said, well, probably not a year. You've probably got less than a year. And she said, no, I'm going to be here a year from now. And when I am, I'm going to dance you a jig. She did, in fact, a year later, come to the appointment, dance a jig, and she actually danced a couple of jigs for a couple of years. This past December, she passed away. And in her obituary, she wrote, "Consider yourself danced."
Many families have touched me over the years. I think we probably learn more from the children. Every day they amaze me and inspire me and give me hope. And I think I've learned more from them than they probably have learned from me.
Apply for the job. There's lots of great nurses here that are very supportive and will take you into the fold and teach you a lot.
22 years later, I'm still loving what I do. I'm so glad that I became a nurse. I feel that I am making a difference in the world, one patient at a time.